Joining us now is Mr. Scott Boruff. He is the CEO of Healthcare Integrated Technologies Incorporated. HITC is their stock symbol. Scott, welcome back to the show.
Don, thanks for having me. You got a little bit better weather today. Last time we couldn't hardly hear, but thanks.
It was kind of windy.
Yes, it was.
Now, for those who might have missed that first interview, why don't you tell us again what the company does?
Yeah, so Healthcare Integrated Technologies is exactly as the name says. We're a healthcare AI technology company, and we're focusing on specifically fall detection for seniors.
Well, you know, my dad spent the last couple of years of his life in a memory care facility. We would have loved to have had your product back then.
Well, absolutely, Don. I mean, I tell you what, the need is so great, and actually, 1 in 4 seniors fall every year, and after the first fall, they just continue to fall. So we're working on predictive analytics and fall prevention with our AI technology.
Well, tell us how your product works.
Basically, it's real simple. You've heard of probably Lifeline, where you have to wear a watch or a lanyard. Ours is, as the name implies, it's ambient technology. So you just hang it on the wall, plug it in, pair it to our dashboard, and it watches your room 24/7, 365. No watches to wear, no lanyards to wear. And if you fall, it sends a video clip and a text to your nearest loved one or your executive director, and they're in the room in seconds.
Now, I can imagine my mom would have loved to have had one of these for my dad. Now, the system basically monitors the room continuously, and anything happens, somebody gets notified right away?
Yeah, to give you an example, like one of our investors' mom finally talked him into going into an assisted care facility, and she was in there the first 2 weeks, and our product wasn't finished yet. And literally, she got out of bed, walked over, made herself coffee, sat on the couch, and got up to go to the restroom. And as most seniors have it, they have their little walkers, and she had her lanyard on the walker. She walks past the walker, falls, breaks her hip. She's only been here 2 weeks, breaks her hip, lays there 2.5 hours in a brand new facility because these nurses and CNAs are overworked, underpaid, turnover is tremendous. And she lay there in pain, and the nearest pull cord was in the bathroom. And so now with our technology that's just installed this last 2 weeks, she had another fall, and her son, which is 69 years old, gets a call at home, sitting there having a scotch with his brother that's 72, talking about mom. His phone rings, fall detected. He answers the phone. He's talking to his mother in the floor. She had just fell in the bathroom. And all of a sudden, while he's talking to mom, the nurses come in. So no more 2-hour waits. He's talking to her. She's fine. Everything's good. The nurses are there within the first minute. So that's priceless.
So the nurse gets contacted at the facility as well as a family member at home?
Yes.
That's amazing.
It's exciting. It's exciting.
You mentioned for your first installation. How did that go for you?
Yeah, it went really well. It took a little bit longer, but we have our backbone installed and our connectivity throughout the building. And we have about 48 out of 62 rooms installed, waiting to get the other signatures from the residents for their approval. And but the people that are there love it. What we learned about that is we had a lady in memory care that was calling out to the nurse, and she had been laying there for like 2 hours. So she had asked us if this safe space could hear, and it can hear only at her request. So we're writing codes now just because of that first installation that says, hey, help, I'm falling, please come get me, please get me out of bed. Certain code words that they say that the artificial intelligence will pick up and call for help. So that's not quite done yet, but it's something new on the chart that we're working on.
What kind of revenues can the company generate from your product?
Well, the good news is we have a recurring model of revenue. So we charge $100 a month per room. And like this one facility that we're currently demoing in, they have 62 beds here, but their parent company has 92 facilities, or about 10,000 rooms. So the market's tremendous. There's over 1 million beds in the independent and assisted living care facility. So we think we can penetrate that within the next 12 to 24 months.
Now, I know you're making a lot of effort to protect your IP. Tell us about that.
Yeah, so we have a Jurgen Vollrath, which is part of our executive C-suite team. He worked for SAP and for a long time and really created the patent process. So not only we just, we've installed, we filed for 15 patents so far this year. So we're taking the product that we're creating, writing patents around it and filing it to protect us and our companies. And we're so excited to have him aboard.
What's next for the company in 2021, Scott?
Well, this AI technology, it's the AI in the sky. So we've got somebody watching you 24/7. It's so, there's so much depth that we can use with the technology, and with the 5G being rolled out across the country. Part of our technology is going to be, right now it takes the nurses about 2 hours to take temperatures in rooms. So this technology will be able to pick that up and do that for them, saves time, saves money. We've got technology that will detect blood pressure in a person's body through our dashboard, ambient dashboard. So there's different layers and different depths of technology that will be accessible as this 5G gets rolled out, and we're excited about that.
It seems like you've taken away all the negatives of a assisted care facility.
Yeah, I mean, we've been living with them for about the last year and a half, and what's exciting is now our product's out, and they literally, the executive director at the very first one that we liked, she goes, she's reaching out to the other facilities in town, i.e. her competitors, and said, you got to see this. This is amazing because it's actually helped. It's a win-win situation. The parents are happy because they know their mom and dad's getting taken care of in the facility 24/7, 365. And the executive directors and nurses and CNAs are super excited because they've got like an extra eye, an extra caretaker taking care of them, which is why they got in the business anyway. They love people, and so they're excited.
Simply amazing. Once again, Healthcare Integrated Technologies Incorporated, HITC is the stock symbol. Scott, congratulations on everything you've accomplished. Thanks for joining us.
Thanks, Don. Look forward to talking again.